Hey everyone, and welcome to today's Explainer. I want you to imagine, just for a second, your city's water system. You know, water flows perfectly smoothly from the main reservoir, runs through a massive network of pipes, and comes directly into your home. But what happens when a major pipe just completely collapses, or a massive blockage builds up out of nowhere? While the water backs up, the pressure skyrockets, and eventually something has got to give. Our bodies actually have their own incredibly intricate plumbing system, and when it faces a severe blockage, the results can be just as catastrophic. So today, we're diving into a condition called obstructive uropathy. It's essentially a critical interruption in the body's natural flow that, if we leave it untreated, can cause some really severe kidney damage. Let's get into it.
Here's a quick roadmap of how we're going to tackle this. We'll start by visualizing the anatomy, then define the blockage itself, explore the different types and causes, look at the backup, which is called hydronephrosis, and finally, we'll talk about how we actually fix the pipes and manage the condition. All right, starting off with Section 1, visualizing the anatomy. Let's ground ourselves first.
To really understand the problem, we need to know how things normally work. Think of the kidney as the body's central filtration and pumping station. It has this central collecting region called the renal pelvis and a tube called the ureter leading down and out. This whole setup is expertly designed to keep fluids moving smoothly in one direction. Your kidneys are continuously producing urine, which then flows down the ureters, into the bladder, and eventually out of the body. It relies on a super delicate balance of pressure in completely clear pathways to function without a hitch.
Okay, moving right along to Section 2, defining the blockage. Let's see what happens when that flow stops.
So here is the big takeaway. Obstructive uropathy is literally a major blockage in our internal plumbing. Medically speaking, it's a structural or functional abnormality that stops urine from flowing the way it should. When the urine can't get out, it creates a massive traffic jam. And just like a traffic jam on the highway, the congestion doesn't just stay right at the site of the crash, right? It backs up. It causes increased pressure and urinary stasis, meaning the urine just sits there, all the way up the chain. Ultimately, this results in renal dysfunction.
And the crazy thing is, these obstructions can happen at almost any level of the upper or lower urinary tract. They can happen way high up, like a stricture near the kidney at the ureter-pelvic valve, or super low down, like a stenosis near the very exit of the system. And location is absolutely critical here. Why? Because a blockage low down in the tract can cause a backup that impacts both ureters and both kidneys. But a higher blockage might only damage one side.
That brings us to Section 3. Types and causes. Let's look at the origins of these blockages.
Doctors first categorize the obstruction by its origin. On one hand, you have congenital obstructions. This means a child is born with a structural defect already present in their urinary tract. On the flip side, we have acquired obstructions. In this case, the urinary tract formed perfectly normally, but a blockage developed later on due to outside factors or other illnesses.
Next up, we have to look at the scope of this plumbing disaster. Is it unilateral or bilateral? A unilateral obstruction affects just one kidney and its connecting ureter. When this happens, the other kidney is often perfectly normal and can actually step up to compensate. But a bilateral obstruction, that impacts both sides simultaneously. The body's entire filtration system is under threat, making it a much more immediate, life-threatening crisis.
Finally, we determine if the blockage is complete or incomplete. And what's really fascinating and honestly kind of scary is that partial or incomplete obstructions might not even show symptoms right away. A child could have a partial blockage and you literally wouldn't know it without a scan. But here is the good news. If we catch it early, the changes caused by a partial obstruction can often be totally or at least partially reversed with early intervention.
So what are the actual culprits here? Well, congenital causes include junction obstructions, where the tubes just didn't form right at their connecting points, or things like a ureterocele, which is basically a ballooning at the end of the ureter. Acquired causes are more physical roadblocks that show up later. We're talking renal or bladder stones, tumors growing and squishing the tubes, or acute trauma to the pelvic area.
I do want to single out one specific congenital cause because it's just so clinically significant. Posterior urethral valves, or PUVs. These are basically obstructing folds of membrane located right inside the inner channel of the posterior urethra. Because this blockage happens so incredibly low in the urethra, it backs up and affects the bladder and the entire upper urinary tract above it. PUVs are a huge deal because they're actually the most common cause of urinary tract obstruction in newborn males, and they're the leading cause of chronic renal injury from obstructive uropathy.
All right, Section 4, hydronephrosis, the dangerous backup. Let's talk about what happens upstream.
Just like a clogged pipe forces water to swell and back up behind the clog, the kidney experiences its own physical swelling, which we call hydronephrosis. Hydronephrosis is the visible dilation or stretching out of the renal pelvis and calyces. Those are the inner cup-like chambers that collect the urine. Since the urine has nowhere to go, the pressure pushes right back against the delicate structures of the kidney itself. It's a very clear physical manifestation of the obstruction. It shows us exactly how much stress the organ is dealing with.
And you can probably guess the complications of this backup are severe. Remember urinary stasis? That stagnant urine is dangerous. It acts as the perfect, warm little breeding ground for bacterial growth. So not only do you have immense physical pressure damaging the kidney, but an infection can quickly set in, totally magnifying the destruction. Over time, this damages the tiny, final filtering tubes in the kidney and drops the overall filtering speed. If we don't go in and clear that blockage, this progressive damage leads straight to chronic kidney disease and renal insufficiency.
Let's move to our final piece, Section 5, Fixing the Pipes. How do we actually manage this?
The clinical response here follows a very clear life-saving path. First up is early diagnosis. Amazingly, prenatal ultrasounds have been a total game changer, allowing doctors to spot hydronephrosis and blockages before the baby is even born. This leads to super early intervention and a huge decrease in permanent kidney damage. Second is surgical correction. Doctors literally go in and bypass the obstruction to fix the plumbing. And third, to manage the flow while the body heals, medical teams will put in external urinary drainage systems.
But you know, recovery definitely doesn't stop at the hospital doors. For kids discharged with these urinary drainage tubes, nursing care shifts directly to educating the parents. The parents basically become the home maintenance crew. They have to be taught exactly how to check the tubes for physical blockages like sediment, tiny blood clots, or even just accidental kinking of the tube. They need strict instructions on cleaning the site, irrigating the tubes, and looking out for early signs of infection. It is a massive, massive responsibility transferred to the family.
And that actually brings us to a vital and often totally overlooked component of medical care. Beyond the mechanics and the surgeries, we have to remember the profound emotional toll this takes. As our source material explicitly points out, parents and children need emotional support and counseling during the potentially lengthy management of these disorders. Think about it. Managing a child's kidney function day in and day out, constantly monitoring tubes, facing potential chronic issues, it is terrifying and exhausting. It requires deep empathy and ongoing psychological support from healthcare providers.
So, as we wrap up this explainer, I want to leave you with something to chew on. We just saw how prenatal ultrasounds are already changing the game, letting doctors detect these exact plumbing blockages while a baby is still in the womb. It really makes you wonder, just how far will prenatal diagnostic technology go? Could we soon see a future where we not only detect, but routinely and non-invasively correct these incredibly complex conditions before a child even takes their first breath? The intersection of technology and pediatric medicine is moving so fast, and the future of saving these tiny, complex systems is looking brighter than ever. Thanks so much for joining me today, and keep exploring.